Today, my topic is the use of artificial intelligence in cardiology, a powerful presence and bright future. At the outset, I would like to express my heartfelt gratitude to my friends and mentors who have inspired me to learn about AI. Professor Dr. Shirihari V. Kulkarni, Dr. Alok Modi, and Dr. Amit Dey. Now, how fast AI is coming into our healthcare practice, you can realize by the very fact that in 2023, the healthcare workers were afraid that they will be replaced by AI. In 2024, they're not worried about being replaced, but they were worried about AI being designed and implemented without them. And in 2025, these healthcare providers are at the forefront of designing safe AI to create a better healthcare for all. So, what I'm going to do in the next 20 minutes is to talk about the uses of AI in clinical cardiology, what is the database evidence we have, what ethical dilemmas we face, and a peek into the future. Recently, in the American College of Cardiology conference held about 10 days back, there was a 1 hour panel discussion on the use of AI in cardiologists. And the goal given was save time, save money, save lives. And they said they put in 3 criteria which must be fulfilled before AI becomes rampant in cardiology. Number 1, AI must reduce burden, it must support equity, and preserve the patient-clinician relationship. To start with, in medicine, there is an ultimate need for the effective triage of patients, effective clinical evaluation, and incorporation of clinical expertise with the latest technologies and evidence-based medicine, accurate decision-making for the right diagnostic and treatment plan. Fortunately, cardiology is at the forefront of AI revolution in medicine. It allows accurate prediction of cardiovascular outcomes, non-invasive diagnosis of coronary artery disease, detection of malignant arrhythmias, and diagnosis, treatment, prediction of outcomes for heart failure. The advancements in AI, the Internet of Things, and precision medicine are going to lead to further innovations in the field of cardiovascular research. However, we are limited by ethical and data privacy concerns which still need to be addressed. As we all know, heart disease or cardiovascular disease is one of the second biggest killers after COPD, with a prevalence rate of anywhere between 4,000 to more than 5,000 per 100,000 across India. To give you an overview of the role of AI in cardiovascular medicine, we have big data coming from the electronic health records, from the diet, ECG, genetics, wearables, lifestyle, software, and we have data coming from the various imaging modalities like CT, echoes, the cardiac magnetic resonance, and SPECT. And by machine learning and deep learning and computer vision, we have automatic diagnosis, continuous remote monitoring, improved decision making, treatment selection, precision medicine, and ultimately reduce costs. To go further into details, the big data that is coming now, we have data from both experimental, biological, clinical, and data coming from the wearables that are being used, which I'll talk about later. When we look at heart failure, we can know about how to prevent it, readmission, reduction, management. In preventive cardiology, we can risk stratify patients. There are multiple machine learning models such as naive Bayes, K nearest neighbors, decision tree, random forest, etc. And they have been used for risk prediction of adverse cardiac events following an ST elevation myocardial infarction. Then we have the advantages in diagnostic cardiovascular imaging, whether it be an echo, cardiac CT, or cardiac MRI, where we can identify and segment of various cardiac structures. We can do lesion identification and classification of images associated with different conditions. In electrophysiology, we can look at the heart rate variability, ECG monitoring, and arrhythmia detection. And also in interventional cardiology, we can look at the fraction flow rates and intravascular imaging. We have developed techniques now that by just looking at the face, images of the face, we can predict outcomes, major adverse cardiovascular outcomes, and coronary artery disease based on a single facial photograph is now available. In clinical cardiology, the basic aim is to improve the accuracy of automated ECG interpretation and aid patient stratification and prognostication. In fact, it can detect subclinical paroxysmal atrial fibrillation from ECGs with so-called normal rhythm, which have been missed by the cardiologist. By deep learning atrial fibrillation detectors, you can see on the lower right, patient had atrial fibrillation. Decision to start antithrombotic therapy for patients with newly diagnosed atrial fibrillation, because we want to know what is the risk of ischemic stroke, major bleeding, and death if we put these patients on anticoagulants. And gradient boosting machine, which is the best performing machine learning algorithm of all, has shown a significant improvement in predicting major bleeding in comparison to the conventional Hasbled score and a death in comparison to the CHAD2-DST2 VAS score. So it can give us that information also. Now, this is a wonderful pragmatic randomized controlled trial done with AI-enabled ECGs for the potential of timely and early detection of ST elevation myocardial function in 12-lead ECGs. And it was shown that the AI-enabled ECG demonstrated a positive predictive value of almost 89.5% and a negative predictive value of 99.9%. But what is more important, in the emergency department, the median door to balloon time was reduced to 82 minutes compared to the control group, which had 96 minutes. So, what message we have learned from this trial? That the incorporation of AI-enabled ECG as an affordable clinical decision support system resulted in a significant reduction in door-to-balloon time, underscoring its potential to enhance the timeliness of care delivery. And it also demonstrated a promising accuracy in identifying potential STEMI cases, thus enhancing the attention of proactive management by healthcare providers. Coming to the investigation modalities like transthoracic echo, AI enables enhancement of imaging measurements accuracy. From a cardiomyopathy point of view, algorithms have been trained from clinical conventional echo data and speckle tracking echo to distinguish between constrictive pericarditis and restrictive cardiomyopathy. They have also been trained to exceed humans' experts' performance in tasks such as the estimation of ejection fraction, assessments of cardiomyopathies, left ventricular segmentation by using EcoNet Dynamic. Cardiac computed tomography angiography has been using AI to maximize information extraction via image acquisition and improve diagnostic accuracy and prognostic outcomes via precision risk stratification. Now, let me show you some images. These are the how echo images AI enabled, how they can exactly automatic border detection can be done, and regional and global longitudinal strains can be looked at. Moreover, endocardial boundary refinements, segments like ventricle for the short axis view, you can detect both endocardium and epicardium, classify, optimize volume classification, and identify cardiac disease. The integration of AI echocardiography marks a pivotal shift in cardiovascular diagnosis, offering enhanced accuracy, consistency, and reliability. By addressing operator variability and improving diagnostic performance, it has the potential to elevate patient care and herald a new era in cardiology. The AI-based computed tomography coronary angiography can automatically assess this stenosis It can look at the hemodynamics, significance of equivocal or minor plaques. It can analyze the composition of the plaques, and it can also evaluate coronary coronary antihypertensive, anti-plaque inflammation burden. Ultimately, we can divide the patients into low, medium cardiovascular rate, high CV risk, or very high CV rate who require urgent revascularization. Coming to clinical cardiology, heart failure, asymptomatic left ventricular dysfunction, we can have early detection, classification, severity estimation, and prediction of adverse events. In cardiac resynchronization therapy for prediction of all-cause mortality or hospitalization at 12 months post CRT, heart murmur detection to enhance the precision of screening for both valvular and congenital heart diseases. And we know the Internet of Things, which is a machine talking to a machine, can be applied for remote health monitoring, chronic disease management, obedience to treatment, adherence to treatment, and medication at home and elderly care. In fact, we can identify cardiac emergencies remotely and by measured by an AI-enabled ECG can be transmitted via blue phone, via Bluetooth to a smartphone for data analysis, and further advice can be given. If there are a lot of wearables, we have the cardia band like the Apple Watch. There are multiple watches. There are almost every part of the body you can have a wearable. But what is very important in this is they're all non-invasive, safe, instantaneous access to patients, user friendly, and allow uninterrupted monitoring and instantaneous individual analysis of ECG signals. And recently, we have the digital stethoscope that can record wirelessly, but also use machine learning software to provide automatic arrhythmia detection, accuracy of 87%, and acoustic based automatic diagnosis of cardiac dysfunction. It can be uploaded online and can be used for teaching purposes. Now, to give you an overview of the US in AI in cardiology, as I talked about identification of various arrhythmias to this support vector machine, determination of the hypertrophic cardiomyopathy from the Atlas heart by the support vector machine, random forest, and artificial neural networks, prediction of all-cause mortality in patients suspected of coronary artery disease undergoing coronary tomography, arrhythmia detections by deep neural networks, detection of subclinical atrial fibrillation, identification of ventricular dysfunction, ejection fraction of less than 35% by convolutional neural networks, phenogrouping heart failure patients, and identifying who's going to respond to CRT implantation, automated analysis of cardiac structure and function, prediction of coronary artery disease on tomography, prediction of all-cause mortality from 1 to 5 years post CRT implantation, prediction of early coronary vascularization within 90 days after doing a SPECT MPI, identification of patients with pulmonary artery hypertension. Now, these are the various overviews I have given you. Now, when we talk about clinical decision support systems, this was a study done, published in JAMA, where from 3 academic medical centers in the United States, 26 attending physicians, 24 resident physicians, both were given 25 generative artificial intelligence chatbot. They were given 6 clinical visits, 60 minutes to find out. Once by using AI and the other through the conventional online resources like PubMed or Cochrane analysis. And there was no difference between the two. However, when ChatGPT alone was used for diagnosis, it gave a reasoning score of 95%. And that was surprising, possibly because the doctors were not yet ready to accept the clinical decisions made by the artificial intelligence. Now, there are certain barriers to implementation of artificial intelligence. We have, especially in our country, limited access to diverse high quality data sets. And there is a black box nature of many AI systems, which impedes clinical trust and adoption. There is a lack of clear legal and regulatory frameworks. People are not ready to adapt it to the existing clinical workflow or incorporate the AI tools. There are challenges in protecting sensitive data, but the biggest problem that everybody is saying that there will be dehumanization of medicine. And this is an AI generated image of dehumanization of medicine. Then there are certain ethical considerations like transparency and explainability, fairness and bias mitigation. Human oversight will need to involve the humans in AI decision making process. Patient autonomy is very important. But I must emphasize here that AI enabled technologies should complement and not supplant the logic and decision making of physicians and other clinicians. Physicians should have the last and most important say when AI is applied for decision making in the medical field. The ethical dilemmas, we know it is rapidly evolving. At times, it may underperform or it may become unregulated. We have hallucinations. So, we need to have robust regulation and quality control. In fact, the FDA has recently released a regulatory framework with aim to establish safe and effective AI-based medical devices. These regulations need to be used also for upgrading the AI products. In fact, the AI projects need to be ethically acceptable, fair, non-discriminatory, and justifiable and worthy of public trust. Then only they can be used everywhere. Now, this is the quality criteria. There must be a clear intended use, rigorous validation, adequate sample size, openness of data and software, and reporting and reproducibility. Let's take a peek into the future. AI is going to be part of every cardiologist's daily routine. It is going to give him the opportunity to effective phenotype his patients, design predictive models for different disease, use non-invasive diagnostics, reduce the need for costly and complicated invasive tests for the diagnosis of coronary artery disease. They'll be by looking at the ECG and echo, they'll be able to tell an asymptomatic patient whether they will develop a lethal arrhythmia or a myocardial infarction and what needs to be done to avoid this. And this will be a game changer. So they must educate themselves in AI today. Let's look at the cath lab of the future. This is the cath lab of the future. And what it is going to do? It can help you in preparing the procedure, risk assessment, non-invasive imaging, early treatment planning, looking at the coronary anatomy, lesion characteristics, regional ischemia, lesion detection, characterization, functional flow assessment, and ultimately guiding robotic procedures. So the key messages that I want to give you, we should embrace our AI to not only automate our mundane paperwork to recover critical human time, but also allow us to practice and enhance our most human skills, that is compassion and empathy. There must be a constant pressure to test all AI as well as human intelligence systems in healthcare to ensure safe, credible, and compassionate counseling and advice for all. We must collaborate with scientists, physicians, and public and tell them the logic behind the applications. The future of AI will depend on how well we can ally these systems with human values and ensure they produce accurate, fair, and unbiased results. While it provides unparalleled opportunities in the advancements of healthcare, a balance between leveraging the technology and retaining the human touch becomes vitally important. So, but what is my take on AI? AI is a powerful ally, augmenting human capabilities, enhancing diagnostic accuracy, streamlining workflows, and potentially elevating some of the burden that contributes to burnout. But when it comes to making sense of a patient's history, understanding nonverbal clues, building trust, and addressing the subtleties of human suffering, there is no substitute for the human touch. And a doctor's role as a healer, counselor, and advocate cannot be outsourced to algorithms. Medicine is learned at the bedside and not in machines. So ultimately, what we are going to have, we are going to use this artificial intelligence to boost our human intelligence and call it augmented intelligence. Now, I have a small tribute to the use of AI in cardiology. In the heart of lab, AI took the stage for some fun. Let's mend these hearts. It's my new endeavor. With algorithms sharp and smart and clever. The docs stood in awe. What's this new tool? AI just smiled. I am no medical fool. I've read all the charts, every beat, every pro, and tell you what's wrong with a precision show. It scanned and it beeped with a digital player. Your patient needs care, but don't despair. A tweak here, a dose there. I've got the plan. Trust me, dear doctors, I'm your right hand man. But then it went rogue, predicting some tunes. The heart beats in jazz with occasional tunes. Docs chuckle softly. You are clever, it's true, but leave the music to us, and then we will work with you. In the heart of the lab, AI is now a friend. With a blend of tech and docs, on the hearts we depend. Together they laugh as they heal with delight. For in the world of cardiology, AI is just right. Thank you for a patient hearing.